Chronic disease is having a growing impact on the health of Australians and the cost of the healthcare system. Chronic disease includes a broad range of illnesses characterized by complex causality, multiple risk factors, a prolonged course of illness, and functional impairment or disability. It has been established that over 7 million Australians have at least one chronic disease, and the associated costs of these healthcare systems are growing. Australian National Chronic Disease Strategy is a national agreed agenda to encourage coordinated action in response to these issues. The NCDS is relevant to patient care because it can be applied to all phases of the patient's journey, from reduced risk through the care and advanced stage of the disease. There are 4 action areas identified in the strategy as essential to achieving the objectives and applying the principles of the NCDS. This electronic blended media presentation explores the link between action item number 4, self-management, the care of an individual with chronic end-stage kidney disease. Chronic kidney disease is one of the 12 chronic conditions identified by the AIHW. My presentation details the experience of Margaret, a 79-year-old widower living with end-stage kidney disease. Margaret is a strong and independent woman who undergoes renal dialysis 3 times per week. Margaret lives alone in a house that was built by her and her late husband. She also has 2 adult children who live at least 3 hours away. Along with the challenges of renal dialysis, Margaret does not drive and therefore relies heavily on patient transport and community services to shop, access services, and attend dialysis. Recently, Margaret's mood has changed, and I've noticed that she becomes angry and upset easily and cries and appears to have a sense of hopelessness about her condition. The action area that I've chosen to apply to the care of Margaret is action area number 4, self-management. Self-management relates to people with chronic conditions actively participating in their own health care. As a care provider, there are opportunities to encourage and support people and their families to develop skills and resources to maximize their capacity to self-manage. Effective self-management results in improved healthcare outcomes and quality of life, and also reduces the burden of care on the healthcare system. The action area of self-management relates to Margaret's case in a number of ways. In order to manage their quality of life, individuals with chronic kidney disease are advised to manage their diet and minimize potassium intake, monitor their fluid intake, control their blood pressure, and keep active and maintain their mental health. Self-management is underpinned by the person being at the centre of their own health care. Margaret complies well with her diet, fluid, and activity requirements, and is a caring and active community member. However, due to the relentless nature of the dialysis, at times Margaret finds it difficult to maintain her mental health. Maintaining mental health is very important for people with chronic disease. Many people with kidney disease experience depression. It has been reported that up to 50% of people with end-stage kidney disease experience depression at some time. Depression is a medical condition that can be treated. The recovery process involves patients first recognizing symptoms and seeking assistance. Self-management of symptoms is vital for patients to continue to experience productive and satisfying lives. Whilst Margaret works hard to maintain her mental health through building a sense of community and actively engaging in her hobby of knitting and crafting, there are a number of factors associated with her health condition that are linked to negative mental health outcomes and may be improved by increased self-management. These include fatigue, reduced physical activity, and stress. The NCDS can be applied to all phases of the patient's journey, including care in an advanced stage of chronic kidney disease. Self-management is an action that patients can be encouraged to take to improve their quality of life and reduce the burden on the healthcare system.